Hi, everybody. I'm Rick Lass, one of the co-chairs of the Retired Members Committee. And I'd like to welcome everybody. Like Anne Marie says, I'll be monitoring the chat throughout, and Dr. Starr will be stopping a third of the way, 2/3 of the way, and at the end, and we will field questions as we go along. But I'll be looking in the chat and um, helping with that. So please put your questions in the chat. I think with almost 70 people here, that would be the easiest way to go. So it's my pleasure to introduce Dr. Rebecca Starr. She recently opened up her own practice, Starr Geriatrics, providing membership-based personalized primary care as well as geriatric consulting. She also serves as a medical director for the Pioneer Valley Memory Care Initiative and oversees geriatric focused projects at Mass General Brigham Cooley Dickinson Hospital. So I saw part of this presentation before, and you're in for a very special time. So without further ado, Dr. Starr, thank you.
Thank you so much, Rick, and thank you for asking me to give this talk. My husband is a fourth grade teacher, so teachers are near and dear, and thank you for all of your time and everything you've done. So let me just take a minute and let me know if you can see the slides here. Okay. And once I've started the slide, sometimes it can be a little hard to see the chat. So Rick, just help me when it comes for it. So everybody's able to see this, correct? Yes. Okay. All right. So this talk is going to go through memory and normal brain changes and things that aren't as normal, give everybody a little bit of an overview. Clearly, this is something that could be quite a big discussion and you could get quite detailed. Obviously, I have a certain amount of time and want to fit this in. And if you have other questions that we don't address, please let us know and I'll do my best to answer them afterwards. So again, thank you. I have started my own practice and we have a Pioneer Valley Memory Care Initiative here in Western Mass. That's in Northampton, East Hampton, and Amherst, and it helps caregivers take care of their loved ones who have some cognitive impairment. So these are our objectives, and I won't read through them, but you can see we're going to go through normal brain changes, talk about different types of memory, and what we can do to make sure our brain is taken care of in the best way it can be. So the brain is really complex. And I think not everybody appreciates that. I mean, I think we know on one hand, but on the other hand, I don't think we always appreciate how much it does, that it really controls everything. Memory, emotion, our walking, motor skills, vision, breathing, temperature. And if you talk to another specialist, and I'm not putting down anybody, we all need all of our organs, but I think people would, often prioritize, I find, the heart over the brain. And I might argue that if you don't have the brain, that's, that's probably the most important thing. But it's made of gray matter on the outside and white matter on the inside. And together, the brain and spinal cord that extends from the brain make up the central nervous system, or as we say, the CNS. So just trying to... Sorry, I'm having trouble doing the slideshow. So let me just see if I can. Okay. So there are the brain is pretty complicated. And so one thing is where are memories stored, right? So the hippocampus, and you can see that is the blue inside the brain. It's pretty in the middle of it. That's where memories first come in and are stored. And so if you think about something like having coffee with a friend, when you're having coffee with a friend, you'll remember the conversation you've had and where you were in all of those. And then that information is transferred as general knowledge to the outside surface of the brain. So coffee can provide me a pick me up, right? What is coffee? This is what it can do. The amygdala, and you can see that is the purple lobe in front of the hippocampus. That is considered sort of our forebrain, our primitive brain, if you will. And that attaches emotional significance to memories. So, strong emotional memories, shame, joy, love, grief, are difficult to forget. And it's a key role in forming new memories, especially related to fear. And this is actually why people who've had a history of PTSD or trauma, that's really embedded deep in the amygdala. And often it does not heal over time, as we've found out. So, short term memory relies most heavily on the prefrontal cortex. And then the long term memory is stored in various places in the brain. So maybe the memory of coffee in one place, maybe the music that you hear in a coffee shop in another place, and maybe what you saw is going to be in another place. With dementia, short term memory is often affected first, and long term memory is often present until late in the disease. And we often hear that. Well, they can remember what they did as a child or what they did 40 years ago, but they can't remember the short term memory. And that's very common. So what is normal aging, right? I think, there's we used to talk about the wisdom of our elders. Now there's such an emphasis on being young, but I think that it's really important to remember that as we get older, there's some great things, right? You can see the entire forest better, but maybe a little worse at seeing the leaves. How does the brain change as we age? What's considered normal? So, just as parts of our body might shrink a little bit, so too does our brain, particularly in the frontal cortex. And often this is just part of aging, it's very normal. As our vasculature, that's our blood vessels, age and our blood pressure rises, the possibility of stroke and ischemia, that sort of a blood not being able to get to arteries, small arteries in the brain. And so these white matter develops lesions. And we often just have them as a matter of fact. Memory decline also occurs with aging, and brain activation becomes more bilateral in memory tasks. So, some changes in thinking are really common as people get older. For example, as we get older, and we might be slower to find words and recall names, but you can remember later in the day. It's on the tip of your tongue. My dad was just here, and he's like, "It's just there. I can just get to it, but you just can't." And then it comes later. You might find that there's more problems multitasking. And we might argue that, actually nobody is really all that good at multitasking, despite what we may think. But as we get older, it gets harder. You might have mild decreases in the ability to pay attention. And I know as teachers, everybody's aware of ADHD and ADD, and this sometimes can get a little worse as we get older. You might misplace things like glasses or look around for them, and they're on the top of your head. And it may take longer to learn new information. All of these things are normal. So, ways that can improve and help maintain your memory. So, learning a new skill, and we'll talk about that. The brain has this amazing neuroplasticity. Follow a daily routine. I remember going out to the store with my grandmother, and she had a place for everything. And it would take us a long time to go into the store and do a transaction because she put everything back in its place. And I remember being, impatient with that when I was 13. But now I see there was such a good reason. She never lost anything. And so having a system is really important. Putting things in the same place every day, having a little place to put your phone and keys and glasses when you come in is can be really helpful. Stay involved in activities that help both the mind and body. Volunteer in your community, at school, place of worship, spiritual care, and spend time with friends and family. And we really found that throughout COVID, that social interactions are so important. And then when everybody was so isolated, it really made a tremendous, many people would say we really noticed memory changes at the start of COVID. So you want to make sure you're getting enough sleep, generally 7 to 8 hours every night, but it is really important. And there's studies that are showing that that's where the amyloid, which is something that can build up and can worsen memory, that gets cleared with sleep. You want to exercise and eat well, prevent or control high blood pressure. Don't drink a lot of alcohol. There's a neuro psychiatrist around here that says you can think or you can drink, but you can't do both. And so there's some truth to that, a lot of truth to that, really. But get help if you're feeling depressed or anxious. That can be called pseudo dementia. And then address hearing or vision changes if they occur. So, when should you be concerned? Right? When are you going to say, you know what, this seems more like something that doesn't seem like a normal aging? Um, and if it's disrupting your daily life, if it's disrupting your habits, things that you do, if you're asking the same questions over and over again, if you're getting lost in a place that you knew really well. I had a gentleman who'd go to the dump, and he went to the dump every Saturday, and it wasn't far, but family got concerned when he got lost going to the dump and then coming back. If you're having trouble following recipes or directions, and it will come out very subtly, people will just say, I'm not cooking so much anymore. It's no big deal, because following a recipe is actually really complicated. You have to remember where you are at each step. And so you'll find that maybe people are not eating in the same way, or they're buying more takeout. You might be becoming more confused about time, people, and places. If you notice that somebody was always immaculately dressed and now that they're not, that can be another clue. Changes in mood or personality, they're getting more irritable, or they're spending a ton of money, and that goes to decreased or poor judgment. They might withdraw from work or social activities, and they might have trouble understanding visual spatial relationships. So, what to do if you're concerned? So, talk to your family and friends to see if they've noticed issues. Often, people, and this is a big thing that we hear about all the time, they don't recognize that they're having problems because that section of the brain is affected early on. And that's called anosognosia. It's a big word to say, you know what? My husband doesn't seem to understand that he's having trouble remembering things. And people take it personally and get really frustrated, but it's actually just part of the brain dysfunction. So if you notice this, talk to your primary care provider that you're having concerns. They might do assessments there, or they may place a referral for further evaluation, either at a neurologist, a memory care center, a geriatrician, which is what I am. And a geriatrician for is just people who take care of people who are older than 65. And I always say by age, but not by how you feel inside, or a neuropsychologist, and they might do a long set of testing. So I want to go through the three most common cognitive diagnoses that we see: mild cognitive impairment, Alzheimer's dementia, and vascular dementia. So mild cognitive impairment, your overall cognition and your activities of daily function are preserved. Activities of daily function are anything you do from the minute you wake up in the morning to getting out of bed to getting dressed and showered. And then there's instrumental activities of daily living. Those are things like shopping, cooking, cleaning the house, paying your bills, taking your medications. So those are all intact, but you're having some difficulty with often short-term memory. And your memory is impaired for your age and education. About 12% progress yearly to Alzheimer's disease, although sometimes it can be reversible. And we'll talk a little bit about that. And we generally monitor that over time. I'll get asked a lot, what is, is this Alzheimer's or is this dementia? Again, is this the Alzheimer's? But you can see that dementia is this umbrella, and underneath it are these different things. Alzheimer's is probably the majority, 60, 80%. Vascular dementia is increasing, especially as we have people living from heart attacks and we're treating their blood pressure and stuff. Lewy body dementia is a type of dementia where you often are falling and have some visual hallucinations. And then there's other types. And again, I think as people get older, we're seeing this mixed dementia, like often in Alzheimer's and vascular dementia. There are other types as well, normal pressure hydrocephalus, and that's where you have fluid building on your brain and you often will have a little trouble walking. You might have urinary incontinence and obviously some memory problems, as well as alcoholic dementia. But there are, at least over 100 types, and I'm sure we'll discover more. So, dementia symptoms, right? So, memory loss, though common, it's not the only sign of earlier to moderate dementia. There might be this loss of cognitive functioning, right? Thinking, remembering, learning, reasoning, and behavioral abilities, right? To the extent that it interferes with a person's quality of life and activities. You might remember things well, but you might have trouble with language. You might have trouble thinking of the word or find that you can think about it, but it won't come out of your mouth. You might have trouble with visual perception or a decreased ability to pay attention. There might be personality changes, changes in personal hygiene, and there could also be some hallucinations or delusions. Now, I know all of these things don't sound great. I will say that majority of people don't have this, but we just want to talk about what you might see. And you might also see anxiousness, sadness as well too. And those can either be a symptom or a cause of cognitive impairment. So it's really important to tease that out. So what is Alzheimer's disease, right? I think that we still don't truly know what causes it, but we know what we find when we're looking at a brain biopsy or on PET scans, that there's these amyloid, beta amyloid protein deposits and these tau proteins. And so you can see the amyloid plaques in this sort of picture, as well as the neurofibrillary tangles. And up until recently, there's been this progressive disease with no known cure, and typical progression is about 10 to 12 years, although that can really vary from just a few years to often people have had problems for 20 years and not much has really changed. So that we think about this in three stages. Mild is year 1 to 3 from the onset of symptoms. And here you might be disoriented to the date. I often hear people say, well, now that you're retired, you're not paying attention to the calendar. And while that is certainly somewhat true, right? If you're on vacation, you have no idea. It's really important that you're able to keep an eye on it and that you could say, all right, well, last, Saturday was the first and today is such and such date, right? You might have some naming difficulties or what we call anomia. Mild difficulty, copying figures, and that's part of the assessment we do. Managing finances, and I think I get to this, but actually one, real big clue for us is financial scams. Now, we know right now that financial scams are everywhere, and it's really easy to be taken in. And so maybe the first time it happens, okay, anybody could happen, but what we hear is often that people have really succumbed to multiple scams. They've been warned not to answer the phone or give out numbers, and they're still doing it. And so, that's an important thing to think about. There might be decreased insight, and social withdrawal is actually a big thing that we see. It's hard to carry on a conversation or hard to remember names, and so you just don't want to go out. You don't want to be embarrassed. Moderate stage is here. It's now progressing a little bit. There's impaired language and calculation, impaired new learning, Now we'll hear that people are getting lost in familiar places, driving difficulties. That gentleman that was getting lost going to the dump, he was in this moderate phase. People are really not cooking anymore or shopping or banking. You might see some weight loss because of that. They can't sequence how to get food into the stove and cook it, and or even to microwave. And there might be some new incontinence as well, bladder and bowel incontinence. You might be having more accidents. And then finally, in the severe stage, here now your remote memory, that long-term memory is now gone. Language becomes harder. You need help grooming or dressing, and there might be some distressing conditions. And I know this isn't cheerful, but I just, want to make sure people ask, when are they eligible for hospice? And it's at this FAST 7C, and FAST is a degree of Alzheimer's dementia. Stage 1 is normal, for example. Stage 5 is moderate, and stage 6 and 7 is severe. So you're hospice eligible at FAST 7C. Means you're bedbound and you're really not talking. Vascular dementia is another one, again, that we're seeing more and more of. It's related to cerebral vascular disease, and you might know people that are having a stroke, for example, but you can often just have these little small microvascular changes in the tiny vessels of your brain. Now, approximately 25% of people who have a major stroke meet um, the criteria for dementia on follow-up at 3 months. And so, just so you know, that this is often common for people who've had larger strokes, and just something to be aware of. But again, it doesn't happen to everybody. So, how is dementia diagnosed, right? I'm lucky as a geriatrician. I have a lot more time than primary care, and my hats go off to any primary care doctor, nurse practitioner, PA, because it's a really hard job. But you want to take this detailed history, right? And you're going to ask about cardiovascular history, depression. How are you sleeping? Are you at risk for sleep apnea? Did you have prior trauma or military experience? Alcohol use, tobacco use, delirium, and family history. And I think that, we're always trained that people will diminish their alcohol use, but this is certainly something that you want to be truthful to your doctor who's asking about this. We also ask about over-the-counter medications. Just because you can buy it over the counter does not mean it's safe. If I could come up with some sort of public service announcement, that's what I would do. These medications can cause cognitive problems, including these Tylenol PM, Advil PM, Benadryl, muscle relaxers, and then other meds that might be prescribed but also have problems, things like anticholinergic medications, meds for insomnia. And so you're going to want to, we always ask the caregiver or family member questions. We do a physical exam. I always look at the feet. So just know, if you ever come to see me, be prepared. I'm going to look at your toes. It tells me how the care is in bathing, and if someone's cutting toenails, that sort of thing. We say that the feet are, the window to the soul. We'll do some cognitive testing. It's usually pretty brief in office lab testing, structural imaging, and then if it seems appropriate, we'll send for a neuropsych referral as well. So just to give you a sense of some imaging, we have an MRI brain here, and you can see the differences in a normal brain versus an Alzheimer's versus an FTD, stands for frontotemporal dementia, and that's going to be the frontal lobes are smaller, if you can see, than the normal brain there. We'll look at blood work. We always check for certain things. And then again, a neuropsych assessment. That's a 3 or 4 hour, they call it a battery of tests. And when you're done, you might feel as if it was a battery, but that can really look at all parts of the brain. So the next steps, people will often come to see me and they want a diagnosis right away, and are, I think it's really important to understand that this is a big diagnosis that we're making, and we want to be as sure as possible. We can't check blood work for this. We can't do an EKG. So we have some work to do. And so really, the only way to determine what somebody has is with a brain biopsy, but we cannot do that when someone's alive, at least at this point. So it's a working diagnosis. And for example, I might write probable Alzheimer's dementia with a possible vascular component. And then I'll write possible contributing factors, could be anxiety, depression. The next steps, we create a plan, including treatment options. We do some care planning, and I think that's really important. We talk about finances, make sure your financial house is in order, if you will. We talk about caregiving, legal planning, and then we arrange for a close follow up. So let's go over what works, what doesn't work, what may work, and the new medication that's out there. So, non-pharmacological approaches, we try to talk about a lot about lifestyle medicine here. Everybody looks at the Mediterranean diet, which is fine, but we know, for example, that there are the blue zones, if you will, areas of the world where people live a long life, but also with great memory. And so I think it's a balanced diet, whatever it is. Um, Physical exercise, so what's good for the heart is good for the brain. Mental exercise, learning a new skill. Social stimulation and connectedness, and I can't emphasize this enough. I see people now that are still very, very COVID cautious, is what we call it. And I do worry that they're so concerned about catching COVID that they're not having any, they're not really seeing anybody. And in the winter, they just totally shut down. And we've seen what that does, both on a mental level and a physical level. So there's some balance, right? Leisure activities, not watching TV. We know that watching TV more than 2 hours in the morning and 2 hours in the evening, for example, is connected to cognitive impairment. There's some interesting studies they're doing in Australia that show that watching television more than that is in some ways equivalent to smoking cigarettes. And then meditation or Tai Chi. And I love them Tai Chi for the mind-body connection, and it helps you with balance and mobility. So it's just such a great thing. I talked a little bit about that neuroplasticity, and I want to talk about it again. Now that everybody here is retired, it's so important that you actually stay active, learning things. There's classes that are out there or learning new skills. This formation of new neurons plays an important part in memory storage, and not even in adult brains, but especially. And so this 2019 study found that the hippocampus, and that's the area where you store those new memories, continues to generate new neurons, even in people who are in their 80s and 90s. So staying active and involved is really, to me, goes hand in hand with keeping your brain in tip-top shape. And so I think it goes to show, well, just because I'm this age, I can't do anything. That's not the case here at all. There's a lot that can be done. And in fact, the people I will say, I've got patients in their late 90s and early 100s. The ones that are the most active are really, they're doing great. So just know that that's a big part of it. So what doesn't work? I don't know who here has heard of Prevagen. It's all over the television. People come in with their bottles of Prevagen. They're proud about it. But even the company has said that Prevagen was no more effective than placebo at improving memory. and it's made out of jellyfish. And so I ask people, are jellyfish known for being really smart? And, you know, they're not. And so, why would we think that jellyfish is going to improve our memory? And it's about $60 a bottle. There's a lot of other things on the market. And the advertising really plays into people's fears about this. So I say better to go get a massage or do something that's actually going to help you. So what may work? Cholinesterase inhibitors, and they are for early to moderate stages of Alzheimer's dementia. They prevent the breakdown of the acetylcholine, and that's a messenger that sort of bridges the neurons and bathes the neurons, if you will, and it's important for learning and memory. It may delay or slow worsening of symptoms. The effectiveness varies from person to person. There's no evidence that higher doses are more effective, so we keep if we're prescribing donepezil or Aricept, for example, we keep the dose at 10 milligrams. And then what I was talking about is do not, if you're aware of it, or just be aware that I see it quite frequently. People are on an anticholinergic and a procholinergic, and they just give double the side effects and cancel each other out. The second medication, and we've really only had these 2 medications around for the last 20 some years, is memantine or Namenda, and this is for moderate to severe dementia. We're not fully sure how this works, but it blocks the actions of a neurotransmitter called glutamate, and it's needed for memory, but too much of it is toxic. And, it appears that in people with Alzheimer's, there's too much of it, and we don't really know why. So here with the donepezil, the medication I talked about before, one of the side effects is urinary incontinence. So I really try to make sure that people are aware of that. And that's why I think people are often on both medications. Um, and also GI effects. With memantine, it could be some dizziness, constipation, and headache are the side effects. So I want to get to this a new class of medications. I know we've got a big group on, so I can't see everybody. If I asked everybody to raise your hands if you've heard of this, but it's called lecanemab or Leqembi, and there's now a newer one out, docenimab. So the FDA last year granted accelerated approval after the results of a phase 3 clinical trial. And for clinical trials, there's 4 phases, and generally they conclude phase 4 before they let a medication out. But they felt that the results were so good, they stopped it. Um, it's shown to moderately slow cognitive and functional decline. And here is actually something that does treat mild cognitive impairment or early Alzheimer's dementia. It was developed by Eisai, that's a company, and it cost $26,500 a year. And that is the cheaper by half than the first medication that came out and is no longer on the market. Medicare now covers this, but if you're interested, you certainly want to make sure that whatever insurance you have will cover it. It works to remove those amyloid plaques from the brain. That was sort of the picture that I showed you. And it slowed decline by 27% after 18 months compared to those who didn't receive it. It requires quite a workup. CSF, that's a lumbar puncture where we take fluid out of your spinal column and see serial PET scans. Those are as well as MRIs. And then, as of now, the treatment itself is quite extensive. You have to get this infusion every 2 weeks for 18 months. The first infusion takes about 4 hours. They go very slowly because you can have quite an allergic reaction. And so I meet quarterly with a group that's doing this across the state of Massachusetts. I think only maybe 2,000 people have been on it thus far. It is quite time consuming, and there's long waits as well. So the side effects, this is something this infusion related, and that's why the first few infusions take a long time. Flushing, chills, fever, rash. And then this, it's called ARIA, and it's amyloid related imaging abnormalities. And so it comes in 2 flavors. One is with edema or brain swelling, and the other is with a brain bleed. And you can see that these brain bleeds are 17.3% versus 9% in the placebo group. And it's mostly microhemorrhages. Those are very small bleeds, but some of them are bigger. I have a patient who's going into Boston and just had her repeat MRI, and it did show a brain bleed. And so they're going to talk about whether or not to continue with it. So it's certainly something that we have, which is, more than we had before. I wanna see personally what it how people do with it, over time, before I would highly recommend it, but, I honor anybody's wishes who wanna go forward. So I think that's there about the medication. I think there's a little bit more actually. So we have time for a few more questions and then I will sum up. So I know there's some questions in the chat and I hope I'm not going too fast. Rick, is the pace okay? I just want to,
Yep, everything's good. Got
okay,
time, and you see the question in the chat, yes?
yes.
Okay.
So, if everybody can see this, you mentioned parents. What about me having a grandparent, parent, uncle, and cousin all on the maternal side? Um, Having dementia. So there are, so I can appreciate the concern that this causes. If you go to Alzheimer's Association, they'll have information on clinical trials. And that's where I would go first to get some information. I'll leave that question about faith in the new blood test. I still think that even if you do these blood tests, it doesn't necessarily correlate that you're going to get dementia or vice versa. So that's important to remember. Uh, okay. Um, all right. Can I please elaborate on effective natural remedies? Um, those are also good questions. I get asked this a lot. The hard part is that often they're not paid for studies, so we don't have a lot of evidence base on this. And I think everybody's looking for something. Again, the things that we actually know work are physical exercise, mental exercise, and sort of meditation. And those have been shown to work as well as social interaction. I can't speak to the natural remedies. Okay. Any other questions? All right. I want to make sure that everybody's still awake. So, um, one thing that I think is really important and probably not addressed enough, and the reason I say this is that I've seen bad outcomes from many people that didn't do these things. And so, if I can make any a change, I think it's so important to have your care planning done. And so just as when you're younger, you make sure, we hope that we have life insurance, we plan for if God forbid something happened to us, how we want to protect our families. So too is this care planning important for everybody, right? You want to make sure that your estate planning is done. And this is really important. If you have a lot of assets and you can protect them by putting them in an estate, I would recommend that because there's this 5-year look back for nursing home placement, and that means that they can look back 5 years and look at your assets and take those. And people need to know that a nursing home is not automatically paid for. It's paid for by your resources until you draw down on all of your money, and then you become Medicaid eligible, and then that's when the government starts paying for it. So I always think it's really important to plan for this. Some people might have long-term care insurance, which is great. Plan for your current and anticipated care needs. Again, people will say, "I want to stay in my house," and I always say, that's a wish, and that's a wonderful thing, but that's not a plan. You need a plan. What happens if you can no longer drive, right? And I think this is really important. Driving in this country is such an important thing. It's our freedom and our independence and who we are. But it's also true that often a lot of us are going to outlive our driving abilities. And so you want to make sure, am I living in a place that I can get resources if I can no longer drive? Or how will I get to places, appointments, not just doctor's appointments, right? You want to do fun things. How will I get there? Think about home safety, advanced care planning. So, again, everybody over the age of 18 should have a healthcare proxy completed. You don't need to go to a lawyer. You can get it online or ask your doctor, as well as a most. One of the things that I do is assess capacity. Does this person have the ability to make healthcare decisions on their own, or should they have their healthcare proxy with them? Overall well-being, so, so important. And, if anybody does have concerns about cognition in a family or friends, this dementia roadmap, from Washington State is a great resource. I don't get any money for it. You can go online and find it. And then, to our point that I see, caregiver stress and strain very high in families taking care of people who have cognitive impairment, and often you're sort of in a sandwich generation, right? You'll have kids and grandkids, or but then you also might have family that has this, and it's really important to support both. So when we bring somebody in, we make sure to talk to both the patient and the caregiver. And if you are a caregiver, make sure you talk to your own doctor about making sure your health is being taken care of. So important. Dementia and driving, I'm just gonna make a note on this. This is one of the hardest things that I have to do in my job. I absolutely hate it, is telling people that they can no longer drive. And, as I'll talk to people who have significant cognitive impairment, and no matter how impaired they are, they always remember my name. That Dr. Starr took away my driving. So, again, it's the hardest thing I have to do, but it's really important. And we know that because people who have dementia are 2.5 to 5 times more likely to be involved in motor vehicle collisions. And if I always tell family members, if you're not going to drive with your loved one, they shouldn't be on the road, right? So, some resources that we use are these clinicians' guide to assessing and counseling older drivers. And just so you know that primary care providers are not really trained in this. I have found in my experience. So just to be aware of it as friends and family too. What are some resources? I think that's really important. 50% of caregivers develop depression. And I think it's important to know that. Be aware of isolation and anxiety and burnout. We spend a lot of time doing caregiver education, and there's a lot of resources. The Alzheimer's Association, there is the Alzheimer's Association on Cape Cod. I don't know if anybody's here from Cape Cod, but I'm so amazed at everything that they do. There are uh, memory cafes where you can go with somebody who has cognitive impairment and do activities. These are some resources as well too. Aging service access plans. In our area, we have Greater Springfield Senior Services and Highland Valley Elder Services, but every area in Massachusetts has an aging service access plan that you can access for all kinds of resources, Shine counseling, what pharmacy plan should you be on, but also help with this kind of thing. And then, our grant, but there's certainly others in the area that really help support people and keep them living in the community. So I believe that is, um, in summary, I think this is really important. We all have different strengths and stories Two people could have an identical looking MRI and have very different pictures. We all have different levels of resilience or trauma or substance use, and all of that changes our own journeys, right? I always say hope for the best, plan for the worst, and then you're always prepared. It takes a village. Don't be stubborn. Ask for help, and build your team. And there is hope for treatment on the horizon. People are working on this, and I really believe that we'll have treatment for this that's going to be long lasting.